Every employee has the right to a safe and healthy workplace. One of the key protections supporting this right is found in the Occupational Safety and Health Administration's regulation, known as OSHA Access to Employee Exposure and Medical Records, located in 29 CFR 1910.1020. This important standard ensures that employees, their designated representatives, and OSHA can access certain medical and exposure records that relate directly to workplace hazards and potential long-term health risks. This regulation exists because exposure to hazardous chemicals, toxic substances, and harmful physical agents can contribute to serious health problems, sometimes years after exposure occurs. Without proper access to medical and exposure information, employees may struggle to diagnose occupational illnesses, medical providers may lack essential data for treatment, and employers may miss opportunities to correct harmful workplace conditions. OSHA established this rule for one very important reason. Informed workers are safer workers. When employees know what they've been exposed to, and for how long, they can share this information with medical professionals, request reasonable accommodations, or ask employers for safer practices. Access also empowers physicians to identify patterns of illness, such as chronic respiratory disease linked to silica exposure, or long-latency cancers associated with asbestos. Ultimately, these protections allow employers to improve safety programs, reduce health risks, and ensure regulatory compliance. Exposure records include any documentation that reflects an employee's potential exposure to a hazardous chemical, biological agent, or harmful physical environment. Examples include environmental monitoring results from air, soil, or surfaces, biological monitoring results, such as lead levels in blood, safety data sheets or SDS logs, chemical inventories, exposure assessments conducted by industrial hygienists, and noise level measurements or sampling results related to hearing conservation programs. Exposure records do not always reflect a confirmed hazard. Sometimes they show potential or suspected exposure. However, they are still critically important because they provide a timeline of workplace conditions, substances used on site, and the presence of any toxic agents. Medical records covered by this standard include information maintained by a physician, nurse, or other healthcare provider. These records may include medical histories and physical exam notes, results of medical tests and lab work, diagnoses and physician recommendations, records related to medical removal, such as removal due to lead overexposure, first aid treatment records, and employee health questionnaires and job-related medical evaluations. Importantly, OSHA does not require employers to create or maintain medical records they wouldn't normally keep, but when these records do exist, employees must be given access. These documents can reveal early signs of occupational disease, like decreased lung function from silica dust exposure or hearing loss caused by excessive noise, and help ensure prompt intervention. Under OSHA's standard, employees have the right to access their own medical and exposure records. They may also designate a representative, such as a family member, union representative, attorney, or healthcare provider, to access these records on their behalf. OSHA officials also have the authority to access these records during an inspection or investigation. In such cases, OSHA must follow strict privacy protections, ensuring personal identifiers are removed except when necessary. Employers must provide records promptly, typically within 15 working days of receiving a written request. If copies are requested, the employer must provide them at no cost or allow the employee to make their own copies. Confidentiality is a critical component of this regulation. Employers must ensure medical records are stored securely and accessed only by authorized personnel. These records may not be shared without written employee consent, except under limited OSHA-approved circumstances. In some cases, employers may provide a medical record summary instead of the full record, such as when a doctor determines that direct employee access could cause harm. Even in these rare situations, employees still retain access through a designated representative. OSHA requires employers to keep both medical and exposure records for the duration of employment plus 30 years. This long retention period exists because illnesses caused by workplace exposures, such as certain cancers, respiratory diseases, and neurological disorders, may not appear for decades. Maintaining complete and accurate records helps ensure that future medical providers can connect symptoms to previous exposures and helps workers obtain workers' compensation benefits when appropriate. Employees have the right to access medical and exposure records that relate to their health. Request and receive copies at no cost. Know what substances they have been exposed to. Understand their health risks. And designate a representative to access records. Employers must provide access within the required timeframe. Maintain confidentiality and secure storage of records. Retain records for the legally required duration. Inform employees annually of their rights under this OSHA standard. Maintain accurate monitoring and medical information. And provide employees with exposure information upon hiring and whenever new hazards are introduced. Imagine an employee who works with solvents and begins experiencing respiratory problems. Access to exposure records may reveal years of concentrated chemical use without adequate ventilation. Similarly, a machinist exposed to noise levels above OSHA limits may need audiometric test records to understand how workplace noise has impacted their hearing over time. In construction, manufacturing, healthcare, and even office environments, exposure and medical records play a pivotal role in documenting conditions that affect long-term health. Access to medical and exposure records is more than a legal requirement. It's a critical safety tool. It ensures transparency, supports early detection of workplace-related disease, and allows both employees and employers to address hazards proactively. By understanding these rights, employees can take charge of their health, and employers can build stronger, safer, and more compliant workplaces.